Hello everyone, my name is Yuzhou Pan. So today I will introduce my master topic of Bio 54. The topic is the relationship between external environmental factors and leukemia. It is well known that it is a terrible blood cancer with a particularly high mortality rate. In this video, I will introduce the causes of leukemia in detail and the effects of various environmental factors on leukemia based on the literatures, which can provide a reference for us to better prevent leukemia. First of all, let me introduce the background of the topic. As the most important blood cancer, leukemia is a malignant clonal disease of hematopoietic stem cells. It is a cancer of the body's blood-forming tissues, including the bone marrow and lymphatic systems. Many types of leukemia exist, including forms occurring in adults and children. Basically, leukemia involves in white blood cells. The pathogenesis of leukemia is caused by the combination of multiple factors. From the picture, the symptoms of leukemia spread throughout the body because of abnormal white blood cells spreading throughout the body, which is why leukemia is difficult to cure. The symptoms of leukemia include fever or chills, persistent fatigue, weakness, frequent or severe infections, loss in weight without trying, swollen lymph nodes, enlarged liver or spleen, easy bleeding or bruising, recurrent nosebleeds, tight red spots in your skin, excessive sweating, especially at night, and bone pain or tenderness. Based on the above understanding of leukemia, I consulted the literature and found knowledge about the etiology of leukemia. In reading the literature, I discovered that the exact source of leukemia is unknown, but various studies have shown that leukemia may be closely related to the environmental factors. So I will introduce the risk factors of leukemia in three aspects. The first factor is chemical pollution. Common chemical pollution includes electromagnetic radiation and common household chemicals. Electromagnetic radiation has a leukemia-causing effect, and its effect is related to the radiation dose and the radiation site. Based on the literatures, nearly 3 times about 15% people under the age of 25 have leukemias related to the electromagnetic radiation. As for household chemicals, related to studies have shown that women exposed to pesticides during pregnancy have an increasing risk of developing leukemia in their children. The second risk factor of leukemia is biological environmental pollution. In recent years, there have been many reports that pollution of interior decoration, furniture, and toys is a major cause of the increase in the incidence of leukemia in urban children. There's a clear link between environmental pollution and the generation of leukemia, including but not limited to air pollution, global warming, melting of frozen soil, and the voids in the ozone layer. At last, I will introduce a few household environmental pollution that are causing leukemia. First one is formaldehyde. Formaldehyde usually comes from the interior decoration process. Prolonged exposure to air containing formaldehyde can cause chromosomal aberrations, crossing linking of DNA and proteins, and lead to leukemia. The second one is the dyes. In recent years, dyeing has been found to be very common, and higher dyes contains substances that cause mutations and carcinogenesis. The third one is passive smoking. Tobacco contains a large amount of benzene, and for non-smokers, it is invisible to inhale secondhand smoke, which causes benzene pollution. Studies show that fathers who experience benzene contamination will potentially initiate the carcinogenic process of the offspring. Current treatment for leukemia are still limited, including chemotherapy, radiation therapy, biological therapy, and targeted therapy, and stem cell transplant. Combinations of this treatment may be used. Surgical removal of the spleen can be a part of treatment if the spleen is enlarged. Scientists are actively exploring better treatments for leukemia. Recently, in October 2019, a study led by the Rice bioscientist Natasha Kruko found that mitokines, anti-cancer drugs, and target mitochondria are particularly adept at killing leukemia cells, especially when combined with a glycolytic inhibitor, while leaving healthy blood cells in the same sample largely unaffected. Their open access paper, a collaboration with the University of Texas MD Anderson Cancer Center, appears in the Nature journal Cells, Death, and Disease. The research could lead to the new way to personalize treatment for patients with leukemia. We also hope that more drugs for the treatment of leukemia will be developed, which will take a big step forward in the treatment of human blood cancer. In conclusion, leukemia is a common malignant tumor in the blood system. Its occurrence is the result of multiple factors. Environmental pollution is a relatively close factor in the occurrence of leukemia. This article introduces the risk factor of the leukemia from the three aspects: chemical pollution, biological environmental pollution, and household environmental pollution. It helps us to understand the impact of the current environmental pollution on the pathogenesis of leukemia, and it is of the great significance for leukemia prevention and treatment. At present, it is necessary to further carry out research on relevant etiology mechanisms, effectively circumvent relevant pollution factors, control environmental pollution, and raise the awareness of prevention, thereby reducing the occurrence of leukemia caused by the environmental pollution. It is necessary to continue to explore and research in the future. And this page is the reference. Thank you so much.